I mean, I'm speaking from a personal experience. My eldest had to have some dental work done at your office a few years ago.
Right.
He was deathly afraid of needles.
That's right.
Big word. And so there was no way I was going to be able to provide the treatment for him myself. Although and then on the flip side, my youngest doesn't care. So
Right.
he doesn't mind needles the same way. But I have to congratulate and really kind of point out what a great patient experience it was for my eldest when he came to your office. Like he you guys brought him in, made him feel comfortable, let him choose a movie so he could watch. And I think the best part when it came to so he ended up having teeth removed, so it wasn't even just simple fillings
Right.
needed to be done, but he was so comfortable. When I took him home, when I was driving home, I asked him, so like, what do you remember? And he was actually shocked that he actually had that the teeth were removed. He didn't even realize the teeth were removed. How comfortable he was. So it kind of goes to show like that's exactly what we want, right? In these types of circumstances, when we have a child that's anxious, that's worried, and we don't want to make the patient experience poor. This is exactly the time where your care is so important, because I feel like all of my adult patients who have a phobia to dentistry is because they had bad experiences when they were young, when they were children, and they remember it and they carry it forward all the way into adulthood. And like my personal philosophy has always been, if I can't do the treatment and keep that child comfortable, I'd rather them come see you, be sedated in a very safe manner, and have the treatment done so that the experience of going to the dentist stays positive. Because there's nothing worse. I mean, isn't that the sort of the worst thing in our profession, of how many patients walk in the door? And, well, you maybe experience it less, but as an adult, as a general practitioner, like every adult patient like these adult patients come in, is like, oh, no offense, but I hate the dentist, or no offense, this is the worst place I want to be, or no offense, I don't want to be here. And usually it's because they've had a bad experience. And so for me, like, keeping positive experiences for children is so important. And I think that's one of the reasons why I see them so young. Like, a lot of parents will ask me, well, why do you want to see them at age 1? And I explain to them, look, 1, it's to get them comfortable with the environment, but 2, it's also for me to start to learn their temperament. Every child has their own different temperament of what's acceptable to them, and what they can handle, and what they can manage, right? And we slowly work them up, right? Every exam, then we can introduce fluoride, and then we can introduce maybe polishing. Some kids can do it and some kids can't. And the ones that can just sit there and do everything, and they don't care what you do, we know those are the ones that if they ever got a cavity, I could probably work on them. But if I still have a child at age 5, 6, 7, and they can barely even get through me having us polish their teeth, there's no way we're going to be able to do fillings on a child like that. So like, knowing that temperament is so, so important. And like having I always look at like all the specialists that I work with. So whether it be the pediatric dentist like yourself, or the orthodontist, or the root canal specialist, or the surgeon, they're just an extension of our team, right? We all kind of work part and parcel with each other. And I really, really appreciate like the communication that occurs between my office and your office. Like, nobody drops the ball. We always know what's going on. So when I refer a patient to you, you already know what's happening. And when you've had treatment, we already know what's happening in terms of it coming back. So that when the patient returns, I already know, oh, okay, the treatment's been done. Or it'd be like, I've had experiences with other offices in the past where I don't get a notice, and I don't hear till like 2 years later, like, oh, they got dental treatment done, or whatever. Right? And so it's really good to kind of maintain that communication. I really appreciate the communication that you have with your office. You guys do a really great job with that.
And I thank you for your compliments. I mean, it's a lot of work. You run an office yourself. You know how much work it takes to try to keep on top of things. It's not always easy, but I think that leads us to record keeping, right? If you have an office that you keep good records, even let's say if I forget to send you a letter telling you I've done treatment on a patient, I can always go back and read my notes, and I know I would remember exactly what we've done, how we did it, and things like that. So I think, It's one of our professional responsibilities that we have to make sure we maintain good records. And I take pride in trying to know my patients as best as I can. Even if I could, because I work with 2 other associate dentists in my office, even if I don't see them personally, I try to take the time to learn about their history when they come into our office, so I would know um, in terms of what was being done, what was being talked about, just because we share our patient load as well. So it's nice for me to understand what they've been discussing and how we're going to go about doing treatment and things like that. And I mean, talking about how you would see adult patients being so anxious coming into your office, I think some of the hardest patients that we have to manage with such phobia, I think a lot of times they really feed off the energy of their parents.
Yeah.
Without knowing, the parents transfer their phobia onto their children. And it could be, like you said, because the parents themselves had a bad experience when they were children. And just by kind of the language they use, or just even little conversations they have at the dinner table, they just would transfer that kind of fear onto their children without even knowing that they're doing it. And I appreciate how you realize that right off the bat and will refer the kind of patients that would need that kind of help before trying to maybe cause something negative and then go, oh no, now that's not working out. Okay, now let's refer. I think it's so much harder when I receive a patient from the referring dentist where kind of so-called damage has been done. And now I have to go reverse the damage and try to gain trust from them.
Yeah.
It's almost like we have to step back 2 steps and then rework our way to regain the trust before I can even get to work on them. Just because drugs are drugs, even though I can give them sedatives to make them more comfortable, but our brain is such a powerful organ that if they are scared, there's very hard to overcome that fear. So a lot of times, so children may need general anesthetic just because they're just so fearful from whatever experience that they have had. Maybe their social situations, maybe their family situations causing that kind of fear. So I totally agree with you, and I, appreciate how you start off your patients really young at the age of 1. I still have parents come through my office every day telling me, oh, my dentist told me I don't need to bring my child in to see them until they're 3. And I mean, this guideline of seeing a dentist before age 1 has been out for at least, I would say, maybe 10 years, maybe even longer. I'm just always shocked that there are still dentists out there telling parents not to bring their child in until they're 3. We would see cavities and issues starting way before they turn 3. Wouldn't you agree?
I've had patients that have told, or friends that have said, "Oh, I've heard conflicting information," and I can attest to maybe there's just some dentists that are not comfortable to see patients that young, and maybe that's a reasoning for why they're deferring. But I absolutely agree with you that seeing them at age 1 is super important. Like I said, like I mentioned earlier, like talking about diet, talking about care, super important. Like I remember anecdotally one patient where like I knew the couple, I knew they were expecting, and I didn't see, and I kept reminding them, yeah, bring your child in. I didn't see that child until about age 3.5. And by the time I saw her, it was a mouthful of decay. She had a cavity on every single tooth. All 20 of her teeth had cavities. And in discussing the history, the child was being taken care of by grandparents, and the grandparents were giving juice in a bottle on a daily basis. And they didn't know, but that all that sugar is what caused all that extensive damage to the teeth. And had I been able to intervene from day 1 to talk about these things, maybe it could have been avoided. But these are sort of the one-off stories that I always stress to people when I talk to parents, especially when they're expecting. I'm already priming them, like, bring them in. We're going to talk about these things, and sometimes I'll even start talking about them when they're coming in for their own examinations and stuff, and we kind of discuss sort of here are things to look forward to, not just in your mouth, but what's going to happen once the baby's born too, right? And I feel like the earlier you can start providing that information, the earlier we can prevent a lot of these things, right?
Right, I totally agree.